Hello everyone, you're watching sqadia.com and I'm Hammad Haider. Today our topic is management of major trauma. In this topic we'll be discussing initially in the first section the burns, especially the thermal and the chemical burns. Then we'll be briefly going through the management and recognition of inhalational burns. As you know, it's one of the very most important things because patients with polytrauma can have associated inhalational injury as well. And this could be very damaging because it actually compromises their airway. In the third section, we'll be briefly touching upon the electrical and cold burn injuries, especially the frostbite, frost nip, and the cold injuries as well. In the fourth section, we'll be going through the different types of shock, cardiogenic shock, what is obstructive shock, what is hypovolemic shock, what is septic and anaphylactic shocks, and how to assess them and how to manage these types of shock. In the last section, we'll be going through the different entities such as MODS or multiple organ dysfunction syndromes. We'll be also touching briefly upon the SIRS, that is systemic inflammatory response syndrome. And lastly, the tetanus, fat embolism syndrome, which is usually associated with trauma, especially the trauma of the long bones and fractures of femur. And lastly, the crush syndrome, which could be traumatic rhabdomyolysis, which could be leading to crush syndrome, or could be due to use of anti-shock garments. Thank you very much. Keep watching sqadia.com.